Alright, today we will be performing a cardiac assessment. First I'm going to perform hand hygiene, and I'm going to ask you to take your shoes and socks off, and I would normally ask you to take off your shirt, but we're not going to do that today. I'm going to ask you to lay down, and I'm going to raise this for your feet. I'm going to assess the apical impulse, which is located here at your pericardium. It would be roughly at the 4th or 5th intercostal space with a midclavicular line on the left side of the sternum. I'm going to look for any lifts or heaves, of which there are none. Normal adult heartbeat would be between 60 and 100 beats per minute, which is normal, regular, relevant, or irregular. The base of the heart stands at the 2nd intercostal space, and the apex sits at the 4th or 5th intercostal space along the midline on the left side of the sternum. Left side of the heart, I mean. I'm going to palpate the chest at the apical impulse, which is again between the 4th and 5th intercostal space. I'm going to ask you to take a deep breath, hold it, and then exhale. Okay, I was able to feel the apical impulse. I'm now going to auscultate your pulses. First would be your aortic valve, which sits at the 2nd intercostal space to the right of the sternum. Your pulmonic valve, which sits on the left, also in the 2nd intercostal space. Your tricuspid on the left, 4th and 5th. And then your mitral, which sits at the 4th and 5th on the right side. So I'm going to listen to both of those. First with the diaphragm. Just breathe normally. Okay, and then with the bell. Okay, S1 and S2 are clear. I didn't hear any extra heart sounds or murmurs. Oscillatory relationship between S1 and S2. S1 is the lub, S2 is the dub. S1 is the beginning of systole, and S2 is the beginning of diastole. S1 is loudest at apex, and S2 is loudest at the base. S1 represents the closure of the AV valves, which is the tricuspid and the mitral. And S2 represents the closure of the semi-ulnar valve, which is the pulmonic and the aortic. I'm going to assess for differences in breathing at your apical and carotid. I'm going to ask you to just breathe normally for a few seconds. Okay, the pulses matched. There was no difference, they were equal. I'm now going to listen for carotid bruits. To do that, first I'm going to ask you to look away from me. I'm going to listen with the bell. I want you to take a deep breath in, hold it, and exhale. All right, turn towards me. And do the same thing with the bell. Deep breath in, out. All right. I didn't hear any bruits. I'm going to palpate your pulses. I'm going to start with your carotid. Okay, your brachial. Your radial. Alright, next I would do the femoral artery, which is located in the groin, found below the inguinal ligament, between the pubis and interior spheric ialic crest. And go down to your feet, feel the dorsalis pedis and your posterior tibial. Okay, all pulses were 2+ and equal bilaterally. I'm now going to palpate your lower extremities for any edema, and I want you to tell me if there's any pain or tenderness. Any pain or tenderness? Okay, there were no edemas present. And lastly, I'm going to examine your nail bed, so can I get your hand? Alright, your hands are a cold temperature. Your nails are convex. I'm going to test your capillary refill time by pressing down on the nail bed and letting go. Your capillary refill time was less than 3 seconds, which is good and healthy. I'm going to ask you to make a diamond with your hands. All right. I can see the diamond, and your angle is less than 160, which means that there's no clubbing present. And that concludes our circulatory assessment.